All right, arthritis. A lot of people have arthritis. So we'll talk about arthritis and then some natural treatment options that you can do other than drugs and prescription drugs. My usual disclaimer, this is not medical advice, this is just information. We don't have a doctor-patient relationship. So, and everything I say could change tomorrow, and it might not be correct based on your individual circumstances, right? A lot of people, ever heard anybody with arthritis say, well, it's just arthritis, nothing you can do about it. Actually, there are some things you can do. Sometimes, eventually, there may not be anything you can do, but usually there's something you can do to help. So, just going to go over what is arthritis, some types and symptoms of arthritis, how does the process start, what causes it, some overlooked causes that you may not realize, some treatment options, and then I'll kind of summarize and take questions. So this is a representation picture of, we could say, a knee joint. So say the knee, the bones come in, you got the bone coming from the top and the bone coming from the bottom, and then there is a cap of cartilage on each end, and then a little space in between them, and a little plastic capsule that goes around and seals the fluid inside. So the red, the dark red, dark pink would be the joint fluid and the space inside the joint. And then on the ends of the bone, you may not be able to see it good, there's a little layer of cartilage, and that's like the cushion. So think about it like the rubber on the rim of the tire. So if you didn't have any tires on, but you had rims, it would be a pretty rough ride. You put the rubber tire on there and give it some cushion, and that makes it a lot better, okay? So arthritis is a chronic disease. It's not something that's going to go away by itself. Typically referred to as wear and tear, bone on bone, joint pain and stiffness, those are all kind of common terms. And osteoarthritis is the most common type. And I'll talk about what that is in a minute. Thought to be normal aging, but it's a little more complex than that because there's lots of people who are 89 years old don't really have a ton of arthritis. So I've still got some 80-year-old patients that go dancing. So this is, arthritis is inflammation in the joint. So itis means inflammation and arthra means joint. There are other things that a lot of people get confused with. So there's tendonitis, so that'd be inflammation in the tendon. That's where the muscle connects to the bone. Myositis, that'd be inflammation in the muscle. Chondritis, that'd be inflammation just in the cartilage. And then osteitis would be inflammation in just the bone. Why is it typically age-related? Well, just because you got more time to damage the joint, basically. That's why it's worse when you get older. Everything's new and fresh when you're 20 and 30. But now there's 30-year-olds with some bad arthritis if they didn't take care of themselves. Fairly common, 80% of people over age 50, you can see some signs of arthritis on an x-ray if you did an x-ray on them. But only 60% have symptoms. So you can have a normal x-ray and you can still hurt. And you can have an abnormal x-ray and not have any pain. So these are the types. Osteoarthritis, good old Arthur. I think Terry Ward was talking about it at church Sunday. His uncle Arthur that his family talked about. That's everybody's heard of good old Arthur. That's the wear and tear. Then there's autoimmune, so your immune system actually attacks the joint, different parts of the joint, and causes trouble. That can be rheumatoid arthritis, psoriatic arthritis, so people with psoriasis, they can get arthritis as well. JRA, that's juvenile rheumatoid arthritis, that's in kids, that's pretty rough. Kids get autoimmune arthritis, that's not good. Lupus, SLE is systemic lupus, erythematosus, lupus for short. And then spondyloarthropathies, there's a whole list of other autoimmune problems that I won't go through. And then infection, you can get a bacteria gets in there and you get an infection inside the joint, that's arthritis. And viruses can actually cause joint arthritis as well. One in kids is pretty common, it's just reactive arthritis. They'll test them and we see that from time to time, kids will get that. And then gout, most people probably heard of gout. That's a good old friend too to a lot of people. For more information, there's actually a pretty good website, the Arthritis Foundation. It's just arthritis.org. You can go there and look. And then Dr. Google is actually pretty good for arthritis. I don't have any problem with you looking up arthritis and stuff like that on Google. This is the Arthritis Foundation website. So you open it up, and at the top right, you can click on About Arthritis. And then you can see the other juvenile arthritis and all sorts of different, also lots of information. So if you click on that, then it drops down, and you can look up what is arthritis. Then the next one, inflammation and the immune system. And then some information if you just got diagnosed with arthritis. So there's lots of different information. I encourage you, if you want more information, to go to this website. It's pretty good. And you see the second one, inflammation and the immune system. Kind of keep that in mind as we go through. I'm going to repeat that quite a bit, but most people don't realize that your immune system plays as big a role in this as in everything as it does. So some signs of arthritis. Most of you can relate to some of these, or most of you resemble some of these maybe. Mild stiffness in the morning, stiffness after rest, pain that worsens when you use the joint, loss of function, so you get to where you can't move your shoulder very far, things like that. That's pretty common. Clicking or crackling sounds. There's the test that usually most doctors will do. You can do it. You can take your knee and bend it and put your hand on top and then straighten it out, and you can feel it grind if you have a little arthritis. It shouldn't be grind. It should be pretty smooth. Swelling, the joint can swell up. Bone spurs. Believe it or not, bone spurs don't really hurt. It's not the spur that hurts. It's what caused the spur that hurts. So the big, I talked about this a lot to my patients. So a lot of people have a heel spur. You've heard of a heel spur? So the spur doesn't hurt. It looks like a knife point on an x-ray. It's like, God, that's got to hurt. It's got a sharp point. It's surrounded by tendon, ligaments. And what happens is usually you stretch the bottom of the foot and it pulls against the heel. Well, your body does what it's made to do. It reacts to that stress and starts laying down more bone. And as it pulls over and over again, every time you take a step, get up in the morning, your feet are killing you, it lays down more bone down that ligament, and it looks just like a knife point. That's a spur. It just means there's some irritation. Something's not right. It shouldn't be having to lay down bone. It's irritating. And so that's what causes bone spurs. So it's not the spur that hurts, but the process that causes it to hurt. And then not as flexible, you lose range of motion. And now, I may get into this, I can't remember if I mentioned this later, but regular arthritis is typically, you're a little stiff in the morning, but you get loosened up when you get going. And then later in the day, it's really bad, aggravates you, your knees really hurt later in the day. Rheumatoid arthritis is not like that. It takes like 30 minutes to an hour to get loose in the morning. It takes a long time to get going. And movement actually helps with that typically. Get the joints warmed up, and that helps a lot. The fluid inside the joint is a lot like motor oil. I don't know if y'all mess with cars or not, but when you first start your car up, oil is cold and thick, and it doesn't lubricate as well. The newer oil is made to be better about that, but in the old days, probably a good idea to warm your car up for a minute before you just took off. And your joints the same way. You warm up the joints, that synovial fluid warms up, thins out a little bit, and does a little better. That's why you want to stretch and warm up before an athletic event, and probably before you get too wild in your day. So arthritis can start for lots of reasons. Just wear and tear can do it. Injuries, inflammation, your immune system attacking it, and then metabolic problems. Diabetics have more trouble with arthritis, and nutrition can play a part in it too. You've got to have the building blocks to make cartilage and to keep it healthy. So cartilage it holds water. Y'all heard of like filler, dermal filler? People make their lips bigger and their face. We do that. But anyway, that is like the same stuff that's in cartilage. It's hyaluronic acid. that holds water, pulls water too. And so on your bones, it pulls a lot of water. Well, if you get dehydrated, the cartilage gets damaged, it doesn't do that. It doesn't have as much cushion. Let's see. So what does arthritis look like to us? So pain, patients will come in, they'll have pain in the joint typically, they'll be stiff, there may be swelling, redness, and then they won't be able to move it, extend their arm all the way, elbow problems, things like that. So on an exam, when I see people come in, it could be tender, when I push on their knee, or their elbow, whatever, swelling around the joint, the grinding, and then on the hands, you can get these nodes. They're actually so common. They have a name, Heberden's and Bouchard's nodes. So on the very tip, this last joint, the last knuckle, that's called the distal interphalangeal joint, or DIP, the DIP. That, if you get people have had enlargement of the joint there, that is a Heberden's node. And then the next one in, that's the PIP. That is a Bouchard's node. And then they don't have names for these. It gets further into the hand, but those are pretty common. Anyway, this knee, can everybody see the swelling on that left side? So rheumatoid arthritis won't do that. That's more osteo or an injury. Rheumatoid is going to be both knees are involved with that. And then it looks like on that edge there, it looks like a little scar. They may have had that knee scoped in the past, but that's beyond healing. So anybody seen somebody with fingertips like that? Yeah. So you can get those. That's osteoarthritis. And the first and second joints typically osteoarthritis. Heberden's and Bouchard's node. And then everybody seen anybody's hands look like that? That's rheumatoid arthritis. Look at her fingers, the tips. Right? She's got her nails painted, looking good, nice pink. But the last couple of joints, they're not really bothered. That looks like the first joint there on her fingers looks normal. But you get to this joint, the MCP joint, and it's destroyed basically. I bet she would have trouble even opening a refrigerator door. So you want to get treated way before it gets to this point. And we've got good medicines now to keep that, but that's rheumatoid. That's going to be an autoimmune problem. And that needs special medicine, which I'll talk about later. But that's a big problem, and nobody these days should get to that point. They may already be there, but we should be able to keep them from that. And then you can actually get, because the tendons contract, you can get different deformities of the finger. There's swan neck, where they can get bent in different directions. So, and then it also starts we call it ulnar deviation. So instead of being able, when your fingers stick out straight, they'll deviate to the side. We call this the ulnar bone. So they'll deviate that direction. Always goes that way. So this is just a comparison. If you can see the dots. So osteo is the blue on the left, and rheumatoid is on the right. And the differences, I'll kind of point out some. You can see the blue on the fingertips, the very distal part. But on the rheumatoid, it affects the further in toward the hand and wrist. And osteo will be one side or the other. A lot of people just have like one bad knee. You can't have two bad knees, but a lot of times one knee is usually worse than the other. With rheumatoid, it's going to be both sides. And then osteo affects the back and spine more. Rheumatoid usually spares the spine. Not always, but a lot more. So when we do an x-ray, you can usually see things like rheumatoid. You can see that pretty well. Osteoarthritis, the edges start looking fuzzy, and they get a little more decay. You can see some swelling of the joints on the x-ray that's not normal, things like that. But anyway, that is a normal x-ray on the right. You see how nice and sharp and smooth the edges are on that hand? That's probably a young man's hand there. All the little bones in the wrist, you can tell where they're at, where they're supposed to be. They all look good. And that on the left is destroyed. The joint space is destroyed. That's the person that could be the x-ray that lady earlier. So get to where you just can't move it. It's not a joint anymore. It's almost fused. So if you start looking into it, somebody's got some arthritis problems. A lot of times you get labs, you go to the doctor, you get a bunch of labs, right? So we should check for diabetes, insulin resistance, things like that, because that can be related to arthritis. Hormones, especially if you know, like I said, mostly women over 55. When you go past 55, it's more common in women than men, arthritis is. And what happens to women around age 50, 52? Menopause, so they lose estrogen. And estrogen is really good for bones, really good for bones. And then thyroid, if your thyroid is off. Now, everybody that comes in my office probably thinks their thyroid's out of whack. Most of the time, it's not. But it does, well, I do have some patients with thyroid problems, but usually the thyroid is not the answer, but it can be. Inflammation, so we can check for different markers. The two most common are going to be the CRP and the ESR, separate CRP. So if you've got rheumatoid arthritis in particular, your doctor probably checks that. One of those two, if not both, every few months to keep an eye on disease activity. So that's how active your immune system is. And then you can check markers for breakdown of both collagen and bone. Telopeptide test there at the bottom. All right. So I started off with this one because it's the easiest. So this is an infection. So if you've got an infection in the joint, a bacterial infection, that usually has to be drained. It has to be treated with surgery, not just antibiotics. Now if it's mild, sometimes you can get away with antibiotics, but I had to send a patient to Jackson today because they had an infected elbow. So that can be life-threatening. You can get septic. It can spread through your body. The bacteria there destroy the joint. You never have good use of it again. So you really want to treat that fairly quickly. And the signs of that are going to be significant. You may have a fever. It's going to be really hot, really swollen, red. Not going to want to touch it. In this case, we actually drained some fluid off a few days ago. Sent it for culture. It came back positive. So that's a big one. But the treatment is straightforward. It's just serious. So then kind of all the other arthritis, there's things that are just good. Either way, if you got rheumatoid or osteo or gout, there's some good things you can do. The anti-inflammatories can help. So even if you got rheumatoid, if it's very mild, you go to a rheumatologist, they're probably just going to tell you to take an anti-inflammatory like ibuprofen or a prescription one like Mobic or meloxicam, things like that at first, and watch it pretty close. But they can cause trouble. Anti-inflammatories, they are hard on your stomach. You can get ulcers. You increase risk of bleeding. So if somebody's on a blood thinner, AFib, or have blood clots, you can't put them on anti-inflammatories because they'll bleed too much. They can block the healing process in some cases, and then you have to worry about the kidneys in particular. They can decrease blood flow to the kidneys. So if you've got kidney disease and diabetes, anti-inflammatories may not be the best option for you. Acetaminophen or Tylenol. Tylenol is pretty good, and that one is just for pain. It doesn't help the process. So Tylenol is not an anti-inflammatory, and we don't actually know how it works, but it's good for pain. So Tylenol for pain is great, but it doesn't do anything to treat the problem. It just...
Is there a difference between Tylenol and Tylenol arthritis?
No, it's all the same. So that's going to be the dose. So I think Tylenol arthritis is 650 milligrams, yeah. So you got regular Tylenol, which is 325, max or extra strength Tylenol, which is 500, and then Tylenol arthritis for maximum, which is 650.
Wow.
So and Tylenol I think is fine. So you can take 4,000 milligrams of Tylenol a day for a few weeks and it won't hurt anything.
Do you think you need to mix the acetaminophen with a ibuprofen?
I do. I recommend to start out with, I recommend 400 milligrams of ibuprofen, so 2 of the over-the-counter ibuprofen, and 500 milligrams of Tylenol taken together at the same time, like 3 times a day. Studies have shown that that was just as good for relieving pain as a 7.5 milligram hydrocodone. And then for long-term use, you can take 2,000 milligrams. So you can take 2 Tylenol twice a day, things like that, 2 to 500. So, but you got to watch it because Tylenol's in a lot of other stuff too. Yeah. Its problem is it builds up in the liver. Some enzymes and things can cause some problems. So if you take too much Tylenol, it's the liver. Too much ibuprofen, it's the kidney and the stomach. People get that mixed up. They'll say, I don't want, that.
What about BCs?
BC is aspirin, I think, mostly aspirin. That's going to be the same as ibuprofen, same effect as ibuprofen. Now BCs may have something else in them. I haven't looked lately. So you got to just be careful, looking at those. But in general, if you take a reasonable amount, ibuprofen or Tylenol, probably not going to do too much damage. But talk to your doctor before you.
Hey Doc, where's diclofenac fit in?
So diclofenac, or and I'm not sure I'm saying it right, but I say it. That is Voltaren. That comes in a pill. It's an anti-inflammatory. So the two most common ones that I use would be diclofenac and meloxicam.
Could I take that and Tylenol? Both?
Yes. You can add Tylenol. It's different. You can add Tylenol to any anti-inflammatory,
Okay.
but you don't want to mix the anti-inflammatory. So
Is that like that Voltaren gel?
yeah, diclofenac comes in a gel.
Yeah.
It's great. It's great quality. Yeah. And lidocaine. I don't think I have it on here, but lidocaine gel is over the counter. There's a patch. Salonpas. That's pretty good too. That just numbs the area. That works pretty good. BioFreeze, that changes the temperature, which checks out, changes how you feel pain. Again, not going to, the anti-inflammatories will affect the disease process a little bit. Tylenol's not going to, lidocaine is not going to, BioFreeze is not going to change what's causing the problem. It's going to help you feel better, but it won't change the problem. Tylenol, any more questions about acetaminophen or anything? But the diclofenac, I like that a lot. It comes in a pill. And you can do both. You can take the pill and the gel.
Right, I have both.
The topical, so that would be an option for you if you can't take anti-inflammatories by mouth. You could put them right where it hurts, and you're not going to get any absorbed into the blood, or at least not a significant amount, so it shouldn't hurt the kidneys. If you're on blood thinners, that would be a good option as well. And when you're in the room with the doctor and we're treating you, we may forget something. We're not going to think of the 50 different treatments that we could give you all at once, right? We're human. So, kind of keep that in mind. If you think of something, ask about it. Don't don't let them run over you. Let them know. If you've heard of something, my buddy, my friend takes this and she got good relief from it, let the doctor know. We need all the help we can get because there's literally millions of things. We're human. We're going to stick with our kind of usual stuff when we're in there. So pain relievers, I think everybody's heard of oxycodone and hydrocodone and things like that. Same with as Tylenol, they relieve pain, but they don't change the disease process. Injections. There's a bunch of different kinds of injections. So this one is steroids and anesthetics, so the old cortisone shot. They actually don't make cortisone anymore, but a steroid, which is derived from cortisol, which our adrenal glands make, and that's an immunosuppressant. So that suppresses the immune system, and sometimes that can be good, but long term, usually there's some negatives that come along with steroids. But an injection in the joint puts a steroid and lidocaine typically, which numbs things. You put that right where it hurts. It doesn't get all through the body. You can get some absorbed, but it goes right where you want it to. It stays there for the most part. So that can help a lot of folks. And doesn't really alter the disease process much, but I've got patients that come about every 3 months and they'll get a shot in their knee or their shoulder, and it can give them some relief, at least for a little while. You hope it lasts 3 months or more, but a lot of times it just doesn't last that long, depending on how far gone the arthritis is. Usually these patients are trying to keep from having surgery. You can't really do them more than every 3 months. You want to give it time to get out of there, because if you give steroids in the joint too frequently, it'll wear out. It'll cause the cartilage to degrade, and that would be even worse. So too much of a good thing. Then there's injections. There's hyaluronic acid. We talked about like the filler and stuff like that. They make some from rooster's comb. They make Synvisc is one brand. There's another one. I can't remember the name of it. I don't do those. I have done them, but I don't do them now. I just refer people to orthopedics and they give them, getting too hard for me to get insurance to cover it and all that sort of stuff. And they're like, I don't think the patients have to pay this, but it's like $400, $500 for a shot for this stuff. But that can help. It gives you hyaluronic acid in the joint capsule. So I've had some patients get really good relief for a year or two from these things or more. So that's something to think about as well. Anytime you do an injection, there's going to be a risk of bleeding or infection. You hit something you don't want to hit. And then price. I mean, these are going to be more expensive than, the steroid and lidocaine. That's just going to be a few dollars medication cost. Topicals, I think we talked about that for the most part. Nerve stimulation. So there's TENS units, so nerve stimulators that you can put on, and those can help. So that's a good thing for pain as well. Kind of distracts the brain. Talked about cold biofreeze is cold, and then you heating pad, a good old heating pad. For your hands, if y'all have problems with arthritis in your hands, paraffin baths work really well. So hot wax, paraffin wax. Yeah, I think they sell them at Walmart. I haven't looked lately, but you can get a thing that melts the wax, and with the wax you put it in there, and then you put your hand in and soak in that. That heat therapy really helps. I've had some patients say that really was good for their arthritis. So anyway, that is there. Physical therapy, actually for osteo, and if you've injured the joint. 15, 20 years ago, I had trouble getting people to physical therapy. Like, oh, you need to do therapy, your back's hurt, you need to go to physical therapy. I'm not going to therapy. But now I don't have to try and sell it quite so much. People are a little more amenable to going. But physical therapy actually works really good. Here's a little bit, if insurance pays for something, it probably has good evidence behind it because they're looking for every reason not to pay for something. So, and insurance pays for the physical therapy, depending on your plan, but they usually pay pretty well for that. So physical therapy is good. And then, let me go. I didn't have it in here, but acupuncture. Some insurance plans now pay for acupuncture. Very good evidence that acupuncture helps. Acupuncture, acupressure. So that pressure is just where they take little beads and put them on certain areas and help relieve pain. So acupuncture, I know there's some people in Jackson that do it. I think maybe Paris. Camden. Does Camden have acupuncture? Yeah.
One of the chiropractors in Lexington does it.
Okay, I didn't know that. Okay. So, and then, in chiropractors too, I was going to say that walking, exercise, yoga is very good if you can do it. Obviously, if you're looking at knee replacement, you're probably not fixing to jump on the stationary bike, right? So, whatever you can do, stay active, that helps. And then braces, things like that. So, knee braces, elbow braces, those are good, but they're more specific. It depends on what's wrong and which joint it is, things like that. And then the last resort, typically surgery. But if you got terrible pain, it's killing you all day long, you can't do anything. Some patients have knee surgery and they're back in the game. They're running around and doing everything that they were before, and no pain. And then I've got a few that had surgery and the knee still bothers them, back surgery, things like that. So it's not a definite, but it can help a lot of people. So more major risk. Yeah.
3 back surgeries.
You've had 3 back surgeries.
And I'm aware.
Yeah. I hear that low back. What I see, this is anecdotal. This is not in the literature. About 50-50. Low back surgery where you'll be significantly better. The neck now, usually is better results. So I'm saying you need it. I don't know if your neck's hurt or not, but I see that. But now knees, just wear and tear. The knee is bone on bone, and you can't hardly get up or walk. Knee replacement's not a terrible option, but it's significant. You're going to be down for a few weeks. You're going to have to do therapy. It's going to hurt. Bleeding risk. Blood clot, things like that. They put you on blood thinners when you have it to keep you from getting a blood clot. The most risky is double knee replacement at the same time. That's the most, which makes sense if you think about it. It's 2 major joints. The knee is one of the most important joints in the body because it bears the weight and all that sort of stuff. But both major joints at the same time, and there's no way to walk without putting weight on one knee or the other if you do both knees at the same time. So you're going to be down longer with that. But the other side of it is you get them both done at the same time and you don't have to go through all that pain and rehab twice. So, but that's a decision between you and your surgeon. We'll go to autoimmune arthritis here. So the drugs we used to treat autoimmune, that's where your immune system is attacking some part of the joint. And there's lots of different parts in that. Are called DMARDs. So disease-modifying anti-rheumatic drugs. A couple of those you may have heard of, hydroxychloroquine, that's why I got Donald Trump up there. That's Plaquenil, hydroxychloroquine, which does not help for COVID, by the way. But anyway, methotrexate and sulfasalazine, they can help. They're the primary care doctor might start those. That's appropriate for us in many cases. They have more side effects than anti-inflammatories, but they're more powerful, and they slow progression. So if you got rheumatoid arthritis, you definitely want to at least be on something like this if you've had it very long to prevent those major changes. And if you're on these and it's progressing, you want to get to a rheumatologist where they can do more advanced therapies, which would include some immunologics. So these target in specific parts of the immune system, not just the whole immune system. They target specific areas. Very powerful, very expensive medicines, more side effects, and rheumatology is going to be, you're going to have to go see a rheumatologist to get these. And these are, you've probably heard some of these names, Humira, Enbrel, Remicade, Simponi. Those are going to be, those are real fancy. If anybody knows me, they know I had to do a weight loss now. Eat right, do all that stuff. I mean, if you got bad arthritis in your knees, and you're not that healthy, weight loss can make a big difference for you. So I'll stop there on that one. So that's kind of medications and surgeries, the traditional medicine approach, and then the things you can do. You can actually eat an anti-inflammatory diet. Like, people don't realize this, but a lot of the foods we eat increase inflammation in our body. And you can be allergic to foods, certain foods, right? Peanut allergies, wheat, gluten, shellfish. You can be allergic to these things. Well, if you eat something and you've got a mild allergy to it, that cross-reacts with the joints or the skin, and you can have a reaction from food you ate that causes your joint pain or rash to be worse. So anti-inflammatory diet to kind of keep that down. Nutrients, you want to make sure you get good nutrition, a well-balanced diet, all your vitamins and minerals. And some of them can actually help down-regulate some of the enzymes that cause problems. Let's see, and then hormones are another option too. You know, postmenopausal women, probably not a bad idea to make sure your estrogen, progesterone, testosterone levels are well maintained. That's another topic. We'll go into that. But anyway, so these are some supplements that you probably heard of. Osteobiflex, that's glucosamine and chondroitin. That's what our cartilage is made up of. Studies show osteobiflex can help with low back pain, knee pain, elbow pain, significantly. So, but it's a lot. Usually you got to take several pills a day, and it's not real cheap either. Even the generic off-brand, not too bad, is not too cheap. And then just straight up collagen supplements. So there's like 4 types of collagen. You want the type that will help your joints. There's usually type 3. But anyway, that's a collagen supplement tub. They come in little stick packs too. You take 1 pack, open it, pour it in your coffee in the morning and take it. These come with scoops. You just take a scoop and mix it with water or juice. Usually not too bad. Usually don't have a lot of flavor to them. And then, so this is one example of a turmeric supplement. I don't know if y'all heard of it. Turmeric is really good for inflammation, joint pain, arthritis. If you got arthritis, do it. I mean, you can sprinkle it on your food, but you got to use a lot of it, of the spice. So this one is pretty good. It's got some other things that can help. So bromelain pineapple is kind of anti-inflammatory. Bromelain from that, and then quercetin, which is curcumin from cumin that can help too, and rutin. I'm not real familiar with that one. And then vitamin C. Vitamin C is good. We have to have vitamin C to make our cartilage and bone. Anybody know the big disease that's caused from low vitamin C? Anybody? I'll give you no prizes. Y'all ever heard of scurvy? Limeys, why they call them limeys. So in England, people go out on the boat, well, they didn't have any fruit. They didn't put fruit on the boat, or no citrus fruit. They didn't have vitamin C. So these sailors would go out for months at a time, no vitamin C. Their cartilage would get weak, and they would be wouldn't be able to work, and they'd get sick, and a lot of them died. So they started putting limes on the boats. When you get a little lime here and there, you get some vitamin C, you don't get scurvy. So that's why they call them limeys. But vitamin C is good for cartilage, so keep that in mind. A little trivia for you. Strontium is really good for bones. I don't recommend this enough, but strontium it helps build bone. It's pretty good. Vitamin D and vitamin K2 together. So vitamin D is good, calcium is good. Vitamin K, vitamin K2, helps push the calcium into the bones. So if you take too much calcium, it can stay around in the blood vessels and speed up hardening of the arteries. Does anybody know anybody that's had a calcium score done by their cardiologist? So you can get a CT scan of the chest, and it will tell you how much calcium is laid down inside the coronary arteries, the arteries that go to the heart. That's called a coronary calcium score. And if that's high, that's not good. You don't want calcium in the arteries. That means they're hardening up and narrowing down. So you can do that. That's coming on. That's more, over the last few years, that's starting to be more common. But you want the calcium in the bone, not in the blood. You want it to get out of the blood and go to the bone. So vitamin K2, if you're on calcium and vitamin D, probably be a good idea to get a combination with some K2. And I don't recommend that enough either, probably. And then hormones, like I said, that's a whole other talk. I may do a hormone talk one of these days. So this is a website, so it's going to be in multiple slides. I apologize. And you don't have to read all this stuff on it. But this is from Harvard. This was from the website Harvard College. This is about inflammation and arthritis. I thought it was neat when I was doing some research for this. So one of the best ways to reduce inflammation may not be a prescription from your doctor, but the grocery store, right? So if you eat certain foods, it activates the immune system, causes more trouble, and it can be from lots of different things. So many major diseases have been linked with inflammation. Diabetes, heart disease, arthritis, depression, Alzheimer's. So you want to choose the right foods. So, and this is not, I can't believe it's not butter, it was not from the Harvard website, but everything else is. So foods that cause inflammation. And if you know me, this is like me repeating this all day. I probably say this in my sleep. I wonder if my wife gets angry with me. But anyway, refined carbohydrates, white bread, pastries, stuff like that. So, I'm always not saying you can't have any. It can cause trouble. So, French fries. There's really no reason anybody should eat French fries. If you're a woman over 40, it slows down your metabolism significantly. I would not recommend French fries for any female. Soda, obviously, I think everybody realizes that sodas are not great for us. Have one every now and then, no big deal. And that's regular soda, not the diet. I won't get into the aspartame, but in my opinion, diet drinks are not that bad. Water's better, more natural stuff is better, but I don't think diet drinks are bad. But regular soda, it can cause a lot of trouble. Red meat, I hate that red meat's on there, but it can cause a lot of trouble for some people. I'm a cattle farmer, so I'm not going to have red meat. And then processed meat, that's really more of the trouble, processing. So the more processed it is, You gotta be careful with that. And then margarine. Anybody heard of oleo?
Oleo.
Oleo? Y'all remember oleo?
Oleo.
You ever heard that anymore? No,
Grandmother
that's
used to talk
margarine.
about it.
Yeah. That was the name. Why did they start calling it something else, y'all?
My grandmother told me when it first came out
Yeah.
during World War II that it was white and they
Yeah.
gave you a little packet to mix with it to make it yellow.
It's probably to make it last longer. It probably had something, you put it together.
But it was color too.
Yeah. Well, anyway, several years, 20 years, margarine was thought to be a lot better than butter, safer alternative to butter. It is not. There's multiple recent studies that show margarine is worse than butter. So I can't believe it's not butter. That was the classic. But anyway, so don't eat margarine either. No French fries, no margarine. Anyway, so some of that, not surprisingly,
We're gonna
a
die.
lot of the same foods. Well, obviously, one French fry never killed me, unless they choke them. Everything in a mass. You can drown in 2 inches of water. So a lot of the foods that are on the inflammation are generally considered bad for our health, right? Sodas, refined carbs, things like this. It's not new evidence. I had to throw this up there for the ladies.
Oh,
you know what that is?
Fabio.
Fabio. I can't believe it's not butter. He was the one that, I don't know, I'm not really a spokesman. I don't think he spoke good.
He probably painted with that.
Yeah. The anti-inflammatory diet. So there were some foods that caused inflammation. Here's some foods that are good to help with inflammation. Tomatoes, surprisingly. Olive oil. Olive oil is fantastic. It is one of the best fats. Olives and olive oil are great. I cook with olive oil. That's what I used to cook with. Use it all the time. Green leafy vegetables. I'm not sure, but I don't think I've ever heard of a good diet that didn't have green leafy vegetables included as a positive. Right? You can get a weird fad diet, but I don't think anybody is going to fault you for eating green leafy vegetables. Nuts are excellent. Walnuts are not my favorite personally. Cashews are my favorite. They're too sweet, but walnuts are the best because they have a precursor to fish oil. So they get converted almost immediately to an omega-3 fatty acid, which is very healthy, inflammation, heart disease, all that stuff. So walnuts are very good. And then fatty fish have the omega-3s in them already. Salmon, mackerel, tuna, sardines. You can't eat those all the time though, due to pollution. You get mercury poisoning. If you ate tuna 3 times a day, you get heavy metal poisoning. So, but you can occasionally, no problem. And then fruits, strawberries, blueberries, cherries, and oranges. These on here are lower sugar fruits. So now, apples not too bad, but there's a big difference in apples over the last 50 years. There is a huge difference between eating a Granny Smith apple and a red Gala or red Delicious apple. There is way more sugar in that huge red apple. You can taste it. I mean, Granny Smith is kind of tart. So as far as sugars, things like that, get the Granny Smith. They're probably a little better for you if you think about it. But strawberries are good. Even the Atkins diet has strawberries. So strawberries, blueberries, they're pretty good. A lot of antioxidants in blueberries. So the good ones are at the top. Fruits, nuts, olive oil, leafy greens, fatty fish. And then down at the bottom, fried foods, soda, refined carbs, lard, processed meats. And then the polyphenols, the cruciferous vegetables, broccoli, cauliflower, things like that, they're good for you. The best diet, everybody asks me what's a great diet. I love keto, but the best diet is the Mediterranean diet. It's good for weight loss, it's good for heart health, it's good for arthritis, inflammation, all those kind of things. It's the diet. Coffee contains the polyphenols. It's good. Looks like it's good for arthritis, so you don't have to stop drinking your coffee. Not that you would have, but anyway. And then antioxidants. Glutathione is great. If you don't know about glutathione, it's the most powerful antioxidant I think that you can take. We give it, so if somebody gets exposed, if they're worried they're exposed to mold and you want to do a test to check and see if they got mold. You can do a urine test and check for mold, some blood tests, but usually we do urine test. You can do the test, and then you give them glutathione for a week or two, and then you do the test again. And the levels go way up. So glutathione detoxes you. Glutathione is a great detox. You don't have to take it forever, but take some glutathione for a couple of weeks, and that's like doing a detox for your body. It helps clear things out. Some vitamins, and then melatonin. Melatonin is a very good antioxidant. Getting good sleep is good for all aches and pains, as far as I know, and mental aches and pains as well. So, try to get 7-8 hours of sleep at night. Get good rest. That's also on every good health plan. So that's pretty much it. Arthritis affects millions of people. It's a chronic disease. Symptoms can overlap, and sometimes labs and x-rays can help, not always, and the treatments vary. I missed gout. The gout's easy. So gout is caused by uric acid. Uric acid builds up, you get too much uric acid, and it forms crystals inside the joint, and when you look at them under a microscope, they look like needles. And so the crystals form, you get too much uric acid, you get the crystals. Usually what happens, something happens, you eat too much chicken liver, or drink too many beers, or just eat a big meat meal, and the gout will flare up and causes trouble. So the treatment for that is pretty easy. We give you a medicine, there's a couple, allopurinol and Uloric, and it blocks the last step in the conversion to uric acid, and it's more water soluble, and so you just pee more of it out, so it drops your uric acid level. So that was pretty easy for gout. But gout, the classic textbook example of gout is the big toe. That first knuckle on the big toe, it actually is so common that gout occurs there, it's got a name, it's called podagra. So that's gout, all right? Well, everybody's gonna eat better and exercise more. They're gonna go run to their doctor and discuss all these new things. You can check us out on Facebook. We got an office Facebook page if they don't take me down. And then I got a few videos on YouTube, and then blog posts. I think I got an arthritis blog post not too long ago at our website. So, all right. Any other questions?